Hello, everyone. How do you feel about needles? If you had to take a needle every day for medication, would you? This is what I have to go through since the age of 9. Most people today know someone that has diabetes. According to 2014 National Diabetes Statistics, about 29.1 million people in the United States have diabetes, which is about 9.3% of the population. Based on the CDC reports, the number of individuals diagnosed with diabetes keeps increasing. We need to start getting informed and educated about diabetes. There is a common misconception about diabetes that is not a serious disease. In researching diabetes, I found that it's one of the worst diseases out in the world today. According to the US News, diabetes causes more death than breast cancer and HIV and AIDS combined together. This disease kills about 3.4 million people in the whole worldwide. Since there are so many lives being lost directly or indirectly to diabetes, it's crucial we understand what it is, how we can manage it, and how we can prevent if possible. I want to share with you what I've learned about diabetes, how can it affect an individual's health, and what can be done to prevent it. What is diabetes? Diabetes is a disease which the body is unable to use and store glucose, a form of sugar, causing one blood glucose to rise too high. As a result, a person with diabetes cannot absorb glucose properly enough, and remains flowing in the blood, which can damage tissue over time. Now that we know what diabetes is, let's take a look at two common types of diabetes. Type 1, juvenile diabetes, usually appearing during childhood, can develop at any age. The body completely stops producing insulin and person becomes insulin dependent. Type 2, adult diabetes. This is the most common type of diabetes. The person at any age can get it, but it's more commonly people over the age of 40. The body doesn't produce any insulin to function properly. Anyone can develop diabetes. However, people that have family history of diabetes, such as myself, are most likely to develop it. The risk of developing diabetes increases if overweight over the age of 40. Other issues are high cholesterol, high blood pressure, and lack of exercise. Some women can develop diabetes during pregnancy. Diabetes is most common among Hispanic, Native, Asian, and African Americans. There's a lot of symptoms, but most of the symptoms are frequent urination, weight loss, increased hunger, blurry vision, and tingly or numbness in the hands or feet, and very thirsty. There are many treatments you can do. As a diabetic myself, I have a lot of snacks around me because my blood sugar tends to go low sometimes. So and to prevent my blood sugar going low, you can keep around some like candy, anything that has sugar in it pretty much will have your blood sugar go up instantly. You can engage in physical activity, which can help the body use insulin better so it can convert to glucose. Individual with type 1, they need to take insulin injections, and in some cases, some people with type 2 take insulin injections, but I haven't seen that. I don't see that quite a lot. Individuals with type 2 usually take oral medication to help their bodies produce more insulin. People with diabetes should see an endocrinologist, which is a diabetes doctor, once every 6 months. Everyone should have regular eye exams because diabetes tends to, if you don't take care of your diabetes, it can mess up your vision over time. And so you go over there so they can make sure you haven't developed problems associated with diabetes with your eyes. Most importantly, individuals with diabetes needs to learn how to manage their glucose levels, which can be hard when you have people around you that are not diabetic. So you want to eat what they eat, like cakes, anything that's sweet, any foods. Anybody that's diabetic, it can relate to me when I say that. You would just want to eat everything anybody eats. You just want to be normal, but you got to understand that your body doesn't produce insulin, so you have to inject yourself or you have to take your medicine, however you take your medicine, to monitor your blood sugar, because if it goes high, it can really damage your body over time if you don't treat it. Complications. Poorly managed diabetes can lead to heart attacks, strokes, blindness, requiring amputation, blood vessel disease, kidney failure, nerve damage. My grandfather recently passed away in 2010 from diabetes complications. He had type 1, like I do. He didn't really take care of himself. He ate whatever he wanted. He didn't inject himself with insulin. He refused to inject himself with insulin, and he had a stroke. And that's what happens when, and that just showed me a lot to take care of myself, take it more seriously, because I didn't really take it seriously back then. I was very young. I didn't really care. And then I just see my grandfather go through all that pain, and it wasn't worth it, because I know he would want to be around now, and knowing what I know now, like, I would do stuff differently. There's no prevention for type 1 diabetes, but for type 2, you can easily make lifestyle changes, exercise on a regular basis. You can lose weight, who are at risk for any form of this disease for type 2. In conclusion, as I pointed out, diabetes is a very serious disease that can lead to a host of complications. We need to make sure we are educated and recognize the signs of diabetes. It's easier to maintain a healthy lifestyle and exercise regularly than to have to inject yourself with insulin each day, which isn't fun at all. Doesn't even get better. Diabetes, without a doubt, is a dangerous disease, but it can also decrease. That gives you an opportunity to control your lifestyle and pull off the complications. Thank you.